Get started here. Welcome. My name is Katie and I work at the Sacramento Public Library, where books are just the beginning. Thank you for joining us for Understanding COVID-19 Vaccines, presented in partnership with HealthNet. Before we get started, I wanted to mention a few things. This program is set up as a webinar and the chat function has been disabled. There will be time at the end of the program to address questions from the audience. If you would like to ask a question at any point during the presentation, please click on the Q&A icon at the bottom of your screen. You can share it there. If you're having any audio related issues, please exit the program and re-enter. Typically, we find that this will solve the problem. Also, today's program will be recorded and uploaded to our YouTube channel, which is Sacramento Public Library, and it'll be available within the week, so you can go ahead and look for it there. And finally, I will be sending an email to all participants following today's program with links and attachments to any resources that are mentioned, so keep an eye out for that. So let's go ahead and get started. With us today is Joan Werblun, RN. Joan spent over 30 years as a diabetes nurse expert for the UC Davis Hospital and Medical School. She's retired from UC Davis, but continues her work in diabetes throughout the state. She is the board chair of the California Chronic Care Coalition, CCCC, one of the founding member organizations of youre which provides reliable, straightforward information about the COVID-19 vaccine and any other vaccines that you may need. Thank you so much for being with us today, Joan, and providing this helpful information. Please feel free to take it away.
Okay, thank you. I'd like to thank everyone for tuning in today, this hour of the morning. For some of you, it may be early. I would like to say that unfortunately, we have to keep doing these classes on COVID. I wish I could open it by saying we don't have to do any of this anymore, but that's not true, and I think it's here to stay for a while. So this is the reason why we're continuing to do classes. A lot of the information you may have already heard. That's okay. A review never hurt anyone. We are going to talk about some of the new things that have happened just in the last 48 hours. So it's an ever-moving target, and so you just have to stay on top of it, which we're trying to do. And it really is every day we're upgrading the website. So let's get started with the slides. Okay. This is just to introduce you. We're understanding COVID, although I'm not so sure we'll all ever fully understand it. Next slide. Okay, let's talk about what is COVID. We all have heard many different explanations of what COVID is, and more importantly, there's a lot of misinformation out there. I get a lot of questions about where did the name COVID come from? What is it? Well, COVID is a name for this virus, which is an offshoot of a virus that has been around for a long time that gives us many of our upper respiratory problems that are caused by viruses. And you may have heard people talk about the severe adult respiratory syndromes. These are all part of the same viral strand, but this is an offshoot. And so a group of researchers got together and they had to give it a name. They couldn't keep going on with this long scientific name. So they came up with CO standing for coronavirus, VI for virus, D for disease, and 19 for the year it was actually discovered, which was 2019. And that's how they put it together. And that's not very unlike what happens to most of your medicines and illnesses. The people who discover them, who work with them, put together a name because we have to call it something. So let's talk about the virus. We know that it's highly infectious. How does it get into us? If you look at the picture down at the bottom, those little balls with the red spikes, that's approximately what this virus looks like in the individual cells. Those little red spikes are proteins. This is a fragile ball, actually, a fragile mechanism. But what happens is our body doesn't recognize it, and so it's able to get in. How does it get into your body? It can get in through your nose, your eyes, through fluid, and your mouth. Okay. This particular virus is really not, it's sophisticated and devilish, but it's really not very strong. It's a weak entity. It also has no way of moving on its own. It has to hook a ride on something. And that's how we are spreading it. It hooks a ride on the air that we are expelling from our mouth, from our nose. And these spores, or they're not really spores, but these cells will hook onto this path of moving air and go into your nose. So if I'm carrying COVID in my mouth and my nose, and I'm talking to you, and I cough, there's going to be a lot of these little mechanisms in that cough, riding on that wave. Think of it surfing right over to you, right into your nose, because you're breathing in air. So this is how it travels. So we have to look at how can we stop that, and what do we do to overcome that, and how are we going to control that? And we'll talk about that as we get into the vaccines. Next slide. How do you know that you're infected? Well, first of all, it takes about 6 days, 6 to 10 days of incubation period for these organisms to latch themselves into your lungs or into your nose, or it goes throughout your body. It takes about 10 days for that to happen. During that time, you may not have any symptoms at all, which is one of the reasons why we're asking people, please, please wear a mask, because you don't know if these cells are in your body yet. What do you know? After 10 days, you may begin to feel symptoms. It's also important for people to realize that some people who've had mild cases of COVID never have any symptoms. They just felt like they had maybe a cold, or their allergies were bothering and they were having a runny nose and a headache. These are the symptoms. You may run a mild fever. You could have light chills. They're not very, very severe. Headaches, a cough, body aches. One of the hallmarks is a loss of taste or smell. I don't know of many other things that could cause you to lose your taste or smell, but this is very prominent in a lot of people. They may have some nausea and vomiting, and there may be some diarrhea, and that was more associated with some of the children than the adults. But any and all of these symptoms, you shouldn't just discard them as something benign. You want to pay attention to them and make sure they're not getting worse. And of course, the best way to prevent this is to get vaccinated. You're going to hear that a lot today. Next slide. Is it serious? Well, we've had hundreds of thousands of people die around the world. It's very serious. And what they die from is the complications, because this virus attacks every organ in your body, your heart, your lungs, your kidneys. And it's these attacks that overwhelm the body and are causing the death. So yes, it is very serious. It's not the common cold. It spreads quickly, and again, through your nose, your mouth, and your eyes. And you may not have symptoms. If you have a chronic disease, such as heart disease or diabetes or other chronic diseases, you have a higher risk of contracting COVID-19, because these other diseases oftentimes lower our immune system. So we need to think about our body as a whole, not just this virus, but it can impact on all of our organs. and make our chronic diseases even worse. Next slide. Okay. If you have COVID and it's getting worse, these are the people that are ending up in our emergency room, and about 98% of the people who are in the hospital now are non-vaccinated. They did not get vaccinated. They have contracted COVID, and now they're in the hospital and they have some of these emergency symptoms that bring them in. And I can tell you right now in the Sacramento area, the intensive care unit beds, which is what COVID patients mostly require who end up in the emergency room, are very low. We don't have many left. Some of the symptoms that tell you that this is getting worse: trouble breathing, a heaviness in the chest. You just can't get your breath. You feel as though you're smothering, and it will continue to get worse. It's not just a one-time thing. It will continue to get worse. Think of it as if you ran a mile and you're out of breath and you're gasping for a breath of air. That's how these people are behaving when they get to this stage. Continuous chest pain. This may be due to the fact that the lungs are in trouble, they're struggling, and you're feeling it and interpreting it as chest pain. Pressure on your chest. You just feel like you have a brick on your chest. Another thing that is happening, because you can't breathe, you don't get a good exchange of air, and there isn't enough oxygen pumping around. You can have some mental confusion. And this is especially hard to separate out when you're dealing with elders in your family who may have some early dementia, other things that cause them to be periodically confused. So you really want to pay close attention to them. Sleeping, inability to stay awake. You see a person who sits down in a chair and nods off, and this is unusual for them. It may be all due to they're having some breathing problems. It needs to be addressed. And also, particularly when you're dealing with elders, look at the color of their lips, fingernails, feet. Do they look bluish? Do they look a blue-gray, a purple-gray? This tells you they're not getting enough oxygen. They need to get to emergency care immediately. Next slide. What we're also dealing with now is having people stay healthy. It's a big mistake to neglect the rest of your health. We're all talking about COVID. Everything is around COVID, and that's appropriate for right now. But one of the things that we're seeing is that people are forgetting about the rest of their health. They're not getting their labs done because they're afraid to come to the lab. They're afraid they'll get COVID. They're not keeping doctor's appointments because they're afraid they're going to get contaminated by someone else in the waiting room. They're not taking all their medicines, or they've run out of their medicines and haven't refilled because they don't want to go into the pharmacy or to the store. It's really important at a time like this, when you're trying to fight off a virus or not get a virus, that your body be fully functioning, that your body is able to have its full strength to work. And that means having all of your other, perhaps chronic diseases, under very good control. And don't forget to get your other vaccinations. Flu season is coming up. They just announced on television news this morning that doctors are recommending that you start getting your regular flu shots in October. Now, some people will be getting their third shot, the booster shot for COVID. So you need to really, really stay in contact with your medical personnel so that you know where you fit into all of these things. But don't forget your other vaccinations, and especially with the kids, make sure that they're getting all of their vaccines that they're supposed to get. You know, my generation remembers thousands of children being in iron lungs from polio. And then we got the polio vaccine and it all went away. We had eradicated it because of the vaccine. So we need to pay attention to our medical people and our scientific people. COVID's an aggressive bully. That's about how I describe it, and those are my words. So you have to do your part to fight back. So let's talk a little bit about with the COVID. We also have a variant now, and this variant is more contagious, if you want to put it that way, than the other COVID. And I don't think anyone is really sure why it is, except that our body doesn't recognize it and it's not fighting it off as well as it should. However, we do know that the vaccines are working against this new variant. So the vaccine is not only working against the original COVID, but it's now working against the new COVID, the variant. But it's estimated to be about 2 times as contagious. And also it takes fewer days for it to incubate. So if you come in contact with someone who has the variant and you have it, it will only take 4 days for it to reproduce itself, or not reproduce itself, but to get ready to infect your body, where the regular COVID takes 6 to 10 days. So it's a little bit more aggressive, and it's a bigger bully, I think. I think we're going to see more of it. So when we talk about the various ways that the viruses do, what happens? What is COVID doing that is so different? Why is it so much harder for us to get something to take care of it? I know a lot of people are very, very hesitant about the fact that the vaccines that we have now were rushed through on an emergency basis. Well, it doesn't mean that steps weren't taken. Everything was done according to the way research should be done. It was just sped up a little bit, if you want to talk about that. And within the last 48 hours, Pfizer's vaccine has been officially approved. It is no longer on the emergency list. It's officially, so I'm hoping that people who worried about getting vaccinated will now be comfortable and go ahead and get the Pfizer vaccine, which is out there. And they've given it a name, just like I showed you how COVID got a name. This vaccine now has a name. It's been out officially for 2 days, and it's now called, and I have to look at my paper, it's Comirnaty is how they phonetically spelled it out. You can see a lot of it if you go online to the CDC, Center for Disease Control. They have a whole paper on this vaccine and the approval. So you can go ahead. But let's talk about, where do these vaccines come from? And they are safe. The standard traditional way of developing a vaccine, such as when we did the polio vaccine or the measles vaccines, they take a very weak strain of the virus and then they have to grow it. And it takes about a year for them to grow the strains. And then they take them and they're able to, they kill them off actually. And then they're made into a serum, and then it goes into a vaccine. So you're dealing with the remnants of the virus, and that's what your body reacts to, and that's why you start to build antibodies. Okay, now with COVID, it doesn't act like your other viruses. COVID, as I said, can't do much of anything on its own, including reproduce itself. It doesn't have the ability. So once again, it has to latch onto our body in order for it to continue living and multiplying. So when the COVID enters your body, it looks for cells to attach to because it cannot reproduce itself. Our body has to do that for it. So it attaches itself to a cell, and it gives that cell the message of how to create more COVID cells. So it's sort of subcontracting out to our body to become the factory to make more COVID cells, because it can't do it on its own. So then our body, having never seen this before, gets this recipe, it looks okay, and it begins to help COVID, and it manufactures more COVID. So we have to stop that process. We have to educate our body. First thing is block the entrance of COVID to your body. Wear that mask. Don't let it get in. The next thing we have to do is educate our body. The scientists were able, if you remember that first slide, those little red spikes, those are protein spikes. They were able to unravel the recipe for those spikes. And they have artificially created that recipe. And that's what we are giving your body in the vaccine. They have taken that artificially produced recipe. It's exactly the same as what's on the COVID, but it's artificial. And now that's what goes into your cell and gives the recipe to your cell. So now when your cell sees that recipe, it knows it's bad and it needs to start building antibodies. And so we are now an antibody building machine once you've had your vaccine. So when the COVID goes into your cell, the cell doesn't recognize it. It knows to kill it. It just won't do anything for it. And the COVID dies, because the COVID on its own can't live. And this is all done in the realm of proteins and a lot of chemistry and physiology. But that's basically what we're doing. We are not giving you a dead virus. You are not getting a live virus. You're not getting virus at all. You are getting the recipe for the virus, but it's been artificially produced. So there's nothing in it. There's nothing that you need to worry about. So I would hope that now that the FDA has said, yes, Pfizer met everything, all of the vaccines have met all the requirements. It's just they wanted them to have more injections, more numbers to look at the outcome. And so Pfizer is the first one to be released, because it was probably one of the first ones that they started using. And the other ones, Moderna and Johnson & Johnson, I'm sure we anticipate within the next 5 days or so, they will be released from the emergency status as well. So that's how your vaccines work. So this vaccine for COVID, just like COVID is a new kid on the block, this vaccine is a new kid on the block, and it is mechanically, artificially manufactured. So you're not getting the COVID virus. Okay, next slide. So we still need to continue with our safety features. We are our own best protector, or we are our own worst enemy, depending on which path you choose. Social distancing. They have studied, and I'm sure you've all seen ads on television for a lot of different medications where someone sneezes and it shows you how far the sneeze went, it spreads out. Well, that's what we're talking about, because with COVID grabs onto those droplets and goes along for the ride. So we want you to stay at least 6 feet apart, because even talking to each other, the breath that comes out of your mouth can go that far, or if you cough. So wearing a mask protects the person you're talking to, and their mask protects you, and your mask protects you from anything that gets out. Okay? Know the symptoms. Don't take it for granted that it's just your allergies or that you've just got a cold. Know those symptoms and pay attention to them, and be in touch with your medical personnel. Get vaccinated. I've said it over and over, and I will continue saying it. You'll see on the slide Moderna, Pfizer, and Johnson & Johnson. Those are the three in this country. There are others in other countries, but these are the three primary ones, and these are the ones we're using. And although they were released for emergency use, it doesn't mean that anything was cut out or any steps were missed. That's important to know. These are all safe. And so it's just a matter of getting more and more and more people that are vaccinated and looking at the results. Remember that it takes 2 to 4 weeks for your body to respond. When it starts making its own antibodies, it doesn't happen overnight. Your body has to get its machinery geared up and going. So for 2 to 4 weeks, you really still want to be careful with wearing your mask. Washing your hands, you've all seen the pictures. Wash your hands and wash in between your fingers, and sing the birthday song, happy birthday song. Sing it twice, and that's as long as it takes, because it's the mechanics of washing in between your fingers, fingertips. That's what is really helpful, along with the soap that you're using. But very, very important, because we tend to do things, we touch things, and then we touch our eyes, or we wipe our nose, or we wipe our mouth. You don't want to do that. You want to really keep your hands away from your face, and really be sure to wash your hands frequently. Hand sanitizers are okay. But again, with hand sanitizers, if you don't use them properly, they're as good as just plain water coming out of the water tap. When you use a hand sanitizer, you want to get enough so that your hands are wet, and you want to continue rubbing until your hands are dry, until the hand sanitizer, it seems like it evaporated, but it hasn't. It's doing its job. But you want to do this until the hand sanitizer is dry. What about, people want to know, should I wipe down tabletops? Things of that nature. Well, it doesn't hurt, because we're not really sure how long the COVID would last on a surface. They're looking at all of this. We do know that in the sun, it dies off in heat. But if you're, wiping off your dinner table, or you go in a restaurant and you see them, they're wiping down tables. People are got their spray bottles, they're wiping everything. The point is, once they've used that antiviral, what they're spraying, it should be on the surface until it dries. It may take 6 minutes or more. But if you sit down and the table's still wet, it's really not protecting you at all. So if you're spraying around your house or whatever, don't spray and then go use whatever you spray. That stuff has to dry. It takes, a good 6 to 10 minutes for it to get that, if there are COVID cells in there to take care of them. So it's not just, a quick squeeze and you're on your way. It's a little bit different. Next slide. Okay, myths and mistakes. The myths are running rampant out there. And, please, just don't read everything. Don't believe everything you read online, I guess, is one of the best things we can say. It was first told, yes, Clorox, bleach, those kinds of things, wiping down surfaces do work, but you don't drink Clorox. I just read some reports from poison control centers saying that, their calls across the country went up by 80-some thousand, in no time at all, because people see something and then they interpret it. Well, bleach and Clorox and things of that nature are not meant for drinking, and it's not going to do a thing to any, COVID cells that you may have somewhere in your body. So please don't do those self-made, stories that your neighbors tell you to do. The latest one that's out is a veterinary drug that is used for, well, it's used for cows and pigs. It's invermectin. It's used on horses and cows to prevent worms, is what it's used for. It's an anti-parasitic. And so it's used in veterinary medicine. It's given to cattle and to horses and all to prevent these parasitic, the worms and things that they oftentimes get in their gut or contaminated wherever they've been. One center said their calls had gone up something like 80,000 in less than a week from people who were overdosing and going to the hospital, having to have their stomachs pumped. They were really, really sick taking this medication. And this is a medicine that also has been looked at to be used in humans for parasites, but it is nowhere near ready to go. I mean, it's just something that is being looked at. And there's a lot of drugs that go from veterinary medicine to humans and humans to veterinary medicine, but this one is not in that stage. And what people are buying, if they're getting it through a prescription or they're getting it from their local vet or the feed store, wherever they're getting it, it's in doses meant for horses. I mean, that it's huge doses. So they're overdosing themselves and they're having all the side effects, and it can have some final, some damage to the liver. And also, please don't pick up these home done things that people are putting around. We talked about wiping down surfaces. You can do that, but you want to do it right. There are no studies showing that gloves provide total protection. In fact, I think it's a false sense of security. People put gloves on, and then you see them with their gloves on, adjusting their glasses or touching their face or something. So I don't know what good the glove is doing to begin with. And I think if you don't have gloves on, you'll be a lot more careful in what you're doing. But the gloves themselves, there's been no proof that it stops this particular virus from getting through. So I wouldn't do it. So again, you want to wear your mask, do your social distancing. And there are some right now, today, they announced that there are some states that are looking at going back to wearing masks for outside activities if it's in an a smaller area, or if there's more than, I think, 200 people, because people do, when they're in a group, they tend to bunch up and talk, and they're much closer than 6 feet. In terms of schools and your children, they're working diligently. The vaccine is now available for 12-year-olds and up. The Pfizer vaccine is the only one approved for children so far. Please get your kids vaccinated as soon as they're old enough to. And a lot of schools are mandating that masks be worn in the classroom, and others are saying no. So it's very confusing. You need to check with your individual schools and see what they're doing. The children aren't having a problem with masks. Kids wear masks. They play robbers. They do all kinds of things. They wear kerchiefs around their face and all. They're not having a problem. It seems to be the parents that are involved in a political thing. So depending on where you live and what your school system is doing, you need to check with that, because kids are going back to school. Make sure that your children are up to date on all their vaccinations, their measles vaccinations, their diphtheria, the polio, all of the shots, so that we don't have a pandemic of another disease that has been eradicated. So that's, some of the things. I'm going to interrupt and say, how are we doing on time? I have no idea.
We've got 20 minutes.
Oh, okay. I thought, well, I know Zoom will shut me off again.
Oh, no, I hope not. So
At the end of 40 minutes. Okay.
yeah, we'll
Why?
save some time at the end for questions, but feel free to keep.
Yeah, and that was, I was going to say, we could take some questions now. Let's see what, we may have jogged some thoughts, some questions. Let's do that now.
All right, wonderful. So I did see one that came through. And again, for anybody who is participating right now, please feel free to use the Q&A function. If you just kind of hover at the bottom of your screen, you'll see the little Q&A button. Click there and you can type in your question. So Joan, I do see one. And it says it's about the booster. So for those of us that are immunocompromised and got the third vaccine, will we
Right.
still need the booster in 8 months?
That it's a good question, and it's an open-ended question. I just read something about it yesterday as we were updating our website. It's not determined yet. I think it's going to depend a lot on where you are. If you're a person who's taking chemotherapy, it would depend where you are in your therapy, whether or not you're going to need that booster shot, that extra booster shot. If you have something like lupus, rheumatoid arthritis, I think it's going to be a decision made by you and your physician where you are in your illness, in your disease status, what you're going to need. They can check for antibodies, and it's a special test. It's not something that's routinely run. And I think at that point, depending on your level of antibodies, that will probably be the determining factor as to how your body's responding.
Okay, that's the only question that I see, but of course we'll still be here for a few minutes in case anybody would like to ask more. This might be a great opportunity to just share a little bit about yourvaccinationguide.org, Joan.
Yeah.
Do you want to just share what that is, what people can find there?
Yeah,
it's a great resource.
well, I'm the president of the board of the California Chronic Care Coalition, and we obviously we represent, I don't know, 20, 30 million people just in the state of California, and we're also national now dealing. We work with other organizations, but our goal is to see that people are provided with the right care in a timely fashion. And we particularly get involved in legislation issues of, who's eligible for certain things and why can't everybody have what they need. So we're involved in legislative issues. And we decided on our website, we were getting so many questions about COVID because we deal with people with chronic diseases and people have very specific questions. And so we said, we need to have a, really good, ongoing, up-to-date website. So it took us, it was about 6 months. There were 4 of us that worked on putting this together. And it's the Chronic Care Coalition with the Healthcare Leadership Council, which is involved in health education across the country. And so we've been working on this, and it's an interactive program. It talks about COVID, it talks about the COVID vaccination, but it also addresses other vaccines. It just is covering everything that people, particularly in the chronic care community, chronic disease community, want to know about what's going on with COVID and what should they be doing. But it's also excellent for the general public. We talk about all the different vaccines. We talk about some of the things we're getting a lot of questions now because people have had COVID for months, are the long haulers. And I think they've named themselves that, the long haulers, following the acute phase of the COVID infection. And the assumption is it may be due to the fact that the COVID affects all of our organs and all of our tissues basically are affected, that there has been such an inflammatory process in our body, in our organs and our muscles and all, that our body doesn't recover as fast as we're used to seeing recovery from the flu. And again, it reminds us this is not the flu. This is a totally different virus, although, way back, its ancestry, it may have been connected. And so what people are seeing is months after they're over the COVID and they're, testing negative, they're having these long-term extreme exhaustion. And it is described as, that you get up and walk to the sink to get a drink of water, and you have to go sit down because you can't take another step. Or as soon as people sit down, they say, I'm not one that naps or falls asleep, but they said, I sit down and before long, my head is down and I'm asleep. They're also describing terrific headaches. They're also describing a lot of muscle aches and pains, like you've been exercising for 2 days straight and they're just exhausted and they hurt all over. And so this is a whole new subset that's coming out of the COVID, and it's the COVID chronic disease, or as they have come to call it, the long haulers. It seems to be going on, and how long it's going to go, we don't know. Some people who are, 6 months, 8 months out say it's less, but it's not gone. And so, we have all, the neurophysiology, you have all of these people working on what is going on. The cardiac people are looking at, was there damage to the heart muscle? Are we having kidney damage? Are we having sustained damage to our vital organs? And are we going to recover? The people who've had kidney disease have not approached the point where they need dialysis, but we don't know where it's going to go. So this is something that was not anticipated. I mean, the emphasis has been on a vaccine and a cure, but what about the hundreds of thousands of people that are now post-acute phase? Because we've been in this and we're going into our second year. Is this something they're going to have to deal with the rest of their life? I think back to the days of polio, because I know adults my age who had polio, and they have what they call a polio syndrome. And a lot of it is the same thing. They get muscle aches, they're tired, they get weak. And so they're the long haulers. It's been many, many years for that. But we don't know. There's been a lot of talk about the long haulers, what it is. You got to figure out what it is before you can really do something. So it's all supportive at this point, what's going on.
Thank you for that information, Joan. I had a couple more questions come in. So the first one is, I'm wondering about why some have reported having negative reactions to the vaccine. What about the vaccine would bring that about? And I think it's a great opportunity to talk about possible symptoms as a result.
The people that have had responses or reactions to the vaccine, what we know is that it's not to the COVID, because remember, the COVID message in there is a negative message. It's not COVID. It's been synthetically produced. But one of the things they're looking at now is their part of the liquid that the vaccine is in that is used is a glycoside, and it's used in a lot of different allergies and different medications. It's just a solution to put it in so you can give it in a shot, because you can't give a powder or something. So you have to suspend it in a liquid. And they're thinking maybe that some people react to that, to the solution. That's an ongoing study, but it's not been discounted, but they say, and I believe them, that it's not from the vaccine itself, the actual COVID part of it, because that's artificially produced. It's the same thing we went through with insulin. Insulin is synthetic now. Humalog is synthetic insulin. But once they cracked the formula for real insulin, they were able then to reproduce it artificially. So it didn't have any of the components, because insulin came from pigs and cows. It was beef and pork insulin, and people started having reactions to that as well. And then when we got the Humalog, we got rid of those, And so the thought is that if they're reacting, it's to the liquid that the vaccine is suspended in. And there's but trust me, a lot of work going on that, because I have a daughter-in-law who has anaphylactic reactions to a lot of things. And she has been advised not to get a shot because they don't know if she's allergic to this glyphosate or not. So that's something we need to follow. And certainly, a soreness at the injection site, a muscle soreness where the injection site was, pain for a day at the injection site. Those are physical traumas. That's the needle going in, and the talent of the person who gave you the shot makes a difference too. I know my first one, I had no pain, no problems. My second one, my arm hurt for a couple of days, but she had a death grip on me when she gave me the shot. So I think that was part of it. So I don't think, and I agree with the scientists, that it's not the vaccine that they're reacting to, it's the solution that the vaccine is in, and they may need to change that.
Thank you, Joan. So I think we have a few more minutes, and we have one other question. I think you addressed quite a bit of it with your the previous answer, but this person is just wondering what the main differences between the different COVID vaccine brands are available.
There's no difference.
Okay.
There's really no difference. It's just in how they cracked the code. They didn't share their science with each other, but then they started working, and they're all the same. Again, it may be in the suspension, in the fluid that the vaccine is in. One may have a different formula than another, but basically they're all the same. And if you couldn't get, you have your first shot of Pfizer, and you can't get a second shot, it's not available, or you're in another town, you can take a second shot of another brand. But when you're dealing with a new product, you want to keep it as pure and simple so that if you do have a problem, it's easier to trace back. So, we're still looking at this, and this is, still unfolding. So, but there's no difference.
All right. Well, thank you so much, Joan, for answering those questions. I think we'll go ahead and wrap it up. We are approaching the 11 o'clock hour. So thank you again for joining us for Understanding COVID-19 Vaccines, and a big thank you to HealthNet and to Joan for this amazing presentation. We hope you got some really helpful information from it. To stay up to date on the latest news around the COVID vaccines, because it does change day to day and sometimes hour to hour, make sure that you visit yourvaccinationguide.org. And as a reminder, I'm going to be sending out a follow-up email that will have a link to that website and any other relevant resources that we mentioned today. Right. And for more information about our health literacy initiatives, ballot box locations, and upcoming virtual programs at the library, just go to www.saclibrary.org. So for Joan, for myself, for the Sacramento Public Library, thank you so much for joining us, and be well. Bye.
Bye.